So when we do the procedure, what normally happens is the patients will come in the morning, they'll meet with our anesthesiologist. The procedure is done with with your sleep. That is optional. We've even had some patients who decided to stay awake and watch the procedure, which is fine. You're on the table for about an hour. It's uncomfortable, so we do want to keep you comfortable. Once you're asleep, what we do is we numb up the skin at the top of your leg in an area called the inguinal area. What passes through there is an artery called the common femoral artery. And so what we do is we go into the common femoral artery with a very small needle. Behind that needle, a small catheter. That catheter is manipulated around to where the fibroids are. Once we get to the fibroids, we inject small particles called biosphere particles directly into the fibroids. They don't go anywhere else. Once they go into the fibroids, what that does is it stops any more blood from getting into the fibroid. It's almost like turning off the water from getting into a balloon so it won't blow up anymore. So once that happens, the fibroids begin to die. And as they die, for many of the women, during a lot of they're suffering from the fibroids, they've passed large blood clots and so on. Well, now that the fibroids are dying, they will actually pass some of those clots. The fibroids will shrink down. The uterus will even begin to change shape. Because of the superior hypogastric nerve block and also the medications we give, there's not a lot of pain afterwards, but we do make sure we monitor our patients 24/7. So most patients stay with us a few hours afterwards. Once we know that they're comfortable, we allow them to go home with a family member. And once they're home, myself and my staff continue to check on them pretty much 24 hours a day, 7 days a week for the next 2 weeks. We also provide every patient with a way to contact us to make sure that they, if there's any simple questions or even more complex questions, that they can always get hold of us.